having the opportunity to get some much needed additional protection. Getting vaccinated is a personal decision. We encourage everyone to make an informed decision for themselves by seeking information from trusted sources. As we've said before, and will say again, there is a massive amount of misinformation online and on social media regarding vaccine. So make every effort to ensure you're getting your information from accurate and reliable sources. This week, our KCHD vaccination team is out in the community immunizing groups and individuals who fall in the first priority group as outlined by the statewide plan. As a reminder, it will take months before the vaccine is available for the general public. Keep in mind, based on the state's plan, there are an estimated 450,000 people within phase 1A. 450,000 people in phase 1A1, which includes frontline healthcare workers, long-term care facilities, first responders, and others. To date, the Tennessee Department of Health has not received enough vaccine to fully vaccinate this first priority phase yet. That's why we anticipate it being several months until the general public can expect to receive this vaccine. To that end, it's important to note that counties and organizations will be moving through the priority groups at different speeds. For example, Knox County may still be in the first phase, while a surrounding community has moved to the second. There are several reasons for this. First, vaccines allocated to specific counties and organizations based on their size. So what we receive in Knox County will differ from smaller counties and communities and organizations. Also, the speed at which we move through the phases depends on the number of people within the priority groups and the folks who are interested in getting vaccinated. Because of all of these factors, the process of moving through the vaccination phases will look a little different depending on the community in which you live. So it depends on how many people are in that group, how many of those people decide to take the vaccine, and how fast, and that really impacts how fast we'll move through these phases. And it's not going to be, we're not going to all be doing it the same way at the same time. Regardless of where you live and what phase you are in, it would be critically important for everyone to continue to follow the 5 core actions, even after getting vaccinated. Experts are still learning about the protection that the COVID-19 vaccine provides, which is why it is important that we continue to use all of the tools in our toolbox to help stop this pandemic, and that includes the 5 core actions. I'll now move to the local situation. We have 162 new confirmed cases since yesterday's report, 5,268 active cases, 163 Knox Countyans are currently hospitalized, and sadly, we have an additional 6 deaths to report today, bringing our total to 312. Before I open it up to questions, I want to urge caution when reviewing the lower case increases over the past few days. While we are hopeful that this could be an indication of things dropping off, it's more likely that this is a reflection of lower testing volumes over Christmas Eve, Christmas Day, and the weekend. And we expect that number will increase as folks get tested this week and next following the holidays. And unfortunately, our hospitals could feel that impact as we move further into January. We can't change the past, but we can change future plans. We continue to urge everyone who is considering New Year's Eve plans to please limit those to just your household. Come up with creative ideas on how to ring in the new year while also being safe. Maybe that means you pick up a meal from your favorite restaurant and get dressed up at home, simulating a night out. Or maybe you have a Zoom game night with your extended family and friends. We know it will look different than past celebrations, but this is what we need to all do in order to keep our community from experiencing another surge on top of the surge we anticipate from Christmas. So really plead with everyone to just celebrate with your household. Do something virtual with your friends if you need to, but keep it within your household to reduce risk for yourselves and those around you. And now we'll open up for questions.
All right, first question we have from Alan with Inside of Knoxville. And I think, Alan, she addressed your first question there. He was asking about the lower case counts over the past couple of days. So if there's anything further you want us to talk about there, please type that in. Also from Alan with Inside of Knoxville, once the holidays clear, do you expect case counts to be similar, better, or worse than the numbers we saw before the holiday?
Wow, that's a great question. It all depends on how people follow the 5 core actions, to be quite honest. I'm not sure what it's going to look like. With our current disease burden in our community, we all need to assume that everyone else and that we ourselves are potentially infected and potentially contagious, unless you know for sure you're not. And so we all need to act like we are potentially getting exposed with every interaction outside our household members. And so that's an important change of behavior. And if we don't all continue to do that, our cases are going to continue to rise in spite of whether we have holidays or not.
Also from Alan with Inside of Knoxville, the state website for vaccines gives a case count, but not a county count. Will that be forthcoming?
You mean a vaccine count?
Yes. Vaccine.
Okay, so not case count. Well, I'll have to get back with my data team about that, but I think right now we're going to be relying on those statewide numbers. I'm not sure if the state is going to break that down by county in the future or not.
From Megan with WVLT, are you able to estimate a specific date when KCHD expects the general public may be able to get the vaccine?
Unfortunately, I'm not, and I know that's really frustrating. It's frustrating for us too. So if you just think about vaccine supply and demand and transport and all that good stuff. So the vaccine has to get produced, and then distributed, and the stuff can happen in vaccine production and slow it down, and it doesn't get distributed as fast, and it has to be distributed across the country. And we're talking about, not enough vaccine right now to cover the entire country. And then, it depends on how much uptake there is among the priority groups. If there's not a lot of uptake among the priority groups, we'll move through those groups faster. I hope that's not the case, because we want those folks to get vaccinated. And we want everyone in those priority groups to strongly consider vaccination as it's a really primary way to reduce risk and prevent disease.
From Katie with WBIR, the snow we experienced on Christmas Eve led to event cancellations and many folks to decide to stay at home rather than go out on the roads. Could that snow have been a saving grace to limit interactions and potential spreader events over the holiday?
It sure could have slowed things down, but based on what we've learned from AAA and others who track travel, I think TSA did the most travel, recorded the most inspections or put through they've since the pandemic started. So I'm not hopeful that the snow here in Knox County will have much of an impact.
From Jeff at WATE, KPD officers started getting vaccines today. Can you tell us what your process was for administering those vaccines to officers? Was there a priority list within the ranks of the officers?
Well, what we did was we communicated with those organizations within the first priority group, so those 1A1 organizations, and let them know when and where we would be administering vaccine, and asked them to share a link, and within their own organization, prioritize folks based on the CDC and Tennessee Department of Health guidance. So we put some of that on them to prioritize their staff with comorbid conditions and older staff and that kind of stuff. So we asked them to do that. And then we used a web-based scheduling system for people to sign up and get a ticket to come to the vaccination event today and receive their vaccine. And so far as I know, I haven't been out there yet, but plan to go later. It's going really well and very smoothly. So we're grateful for that.
Also from Jeff, he asks, are you concerned that members of the public may show up looking for a vaccine when KCHD goes out to vaccinate officers or others?
Certainly could happen, and our staff is prepared for that.
From Katie with WBIR, according to federal data that shows hospitalizations and ICU bed use across the nation, more of our rural counties in East Tennessee have a higher percentage of ICU beds that are filled by COVID-19 patients. For example, Knox County has 64% of ICU beds full, while Knox County has 22% full. What could be the reason behind that?
Yeah, I'd have to look at that data. So I can't really, it's hard for me to answer that question without seeing the data you're referring to. So, Knox County Knox County has fewer ICU beds than Knox County does. It's a smaller county with a smaller population. Again, I haven't seen that data, so I'd have to look at it. Don't really want to speculate.
Also from Katie, The state surpassed 3,000 COVID-19 hospitalizations today. Are Tennessee hospitals equipped to handle this and impending post-holiday surge?
So hospitals are, at least I can speak to what Knox County hospitals are doing. They're working together. They're meeting daily to discuss case counts and strategize. I don't know what hospitals are doing across the state. Those are great questions for the hospitals. They know their capacity. They know how much they can expand well, much better than I do.
Also from Katie, in person, Knox County students are set to go back to class in 1 week on January 5th, unless otherwise notified by the school district. Has the health department been in touch with KCS? Any recommendations or concerns?
We meet with Knox County Schools on a weekly basis with their administration and make recommendations regularly. As you know, we've recommended considering changing or altering extracurricular activities for the spring semester. The school board or the school administration has made their choices based on the information they have and what they think is best for the students.
From Megan with WVLT, what would you say to those who have reservations about the safety of the vaccine?
Well, I think one, seek out information. Getting vaccinated is a personal choice, whether it's the flu shot or a brand new COVID vaccine. But what I would say to folks who are wondering, is it safe? And, like I normally take a flu vaccine, but should I take this one? This vaccine has not been developed with any shortcuts. All the safety measures have been in place. What's been different about this vaccine is that things kind of happened together. Normally it's kind of a stepwise, you do all your research, you get it approved, and then you start making vaccine. Here they did their research, started making vaccine, and got it approved all at the same time. So that sped things up a whole lot. They took a big chance that it might not get approved. The federal government helped with that with a lot of money to make sure they didn't lose all that money. Because you can imagine if I develop something that doesn't get approved, I really don't want a whole lot of that product to have to get rid of. So one of our analogies is that this is like swim lanes. It's not a relay race. Normally it's like a relay race. You hand off the baton to the next step. These steps kind of happened in tandem at the same time, which sped things up, but did not require shortcuts as far as safety goes.
Also from Megan with WVLT, how is KCHD preparing for the expected spike in cases coming in January with hospitalizations already at all-time highs? What can the public do now to mitigate the strain on health systems?
Well, what we are encouraging everyone to do is follow the 5 core actions and stay the course and be diligent about that. And that, continue, really is up to you, the citizens of Knox County, how big the surge is, how many more cases we have, the 5 core actions. Try to maintain 6 feet of distancing, wear a face mask when you're outside your household, wash your hands regularly, don't go anywhere if you're sick, and clean surfaces regularly. So what we'll be doing is we'll continue to be contact tracing, doing limited contact tracing and case investigations. What we encourage you to do is to keep track of your contacts so that if you become a case and you can reach out to those folks that you were around 2 days prior to that and say, hey, I've been diagnosed with COVID. You need to quarantine. And send them to our website where they can use the isolation and quarantine calculator, which is kind of a really cool tool. And it'll tell them what date the quarantine starts and what date it ends and what day their isolation starts and when it ends and all the different nuances related to that. So we are also asking you to help us do some contact tracing and limit spread among your family and friends.
From Sarah with the Sentinel, where are Knox County Health Department staffers giving out the vaccine to the first group? Are they mostly being injected at the health department or out in the field?
We're at a location outside the health department.
From Jeff with WATE, the inactive case count went down today from 27,121 to 27,119. Can you tell us why?
This is Charity Menifee in the background. That's just a natural rollover as people roll in and out of case counts. Sometimes that happens, especially since we had a low number of new cases today. It's just keep an eye on the trends is really what we ask you to look at.
Jeff has a question to follow up on Sarah's question from a minute ago, asking Is KCHD keeping the vaccination site confidential out of concern for the public showing up?
These are what we call closed or private pods. Closed is another way to use that. Point of dispensing is what pod stands for. So that we can truly target those folks who've been in the front lines, first responders and others who've been in the front lines throughout this pandemic, to protect them so they can stay in the job. And so that's what we're doing at this time. Yes.
Any further questions? Please go ahead and submit them now. Also from Jeff with WATE, can you quantify or elaborate on what you mentioned about lower case/testing numbers around the holidays? Are you concerned people will relax their precautions too much again? And when do you expect testing to pick back up?
Well, testing's picked back up this week, but here, at least for us, and I'm assuming providers are back in the office and testing again. So, we had a holiday that happened to be attached to a weekend. So a lot of offices, and we even, I think we stopped testing early that day. So a lot of offices didn't test all day on Christmas Eve. New Year's is coming. Christmas Eve, Christmas Day, a lot of offices were closed. So there wasn't a lot of testing going on. And then over the weekend, offices weren't open either. And we always see a decrease in the number of tests performed over the weekend. So we expect that these low numbers that we're having now are a result of not as many people getting tested because there wasn't as much access. We expect those numbers to go back up this week since offices have opened back up. It is another short week. Some offices will close early and or not be open on New Year's Day. So we'll have to see how that impacts numbers next week.
Any further questions? Please go ahead and submit them. From Claire with WUOT, Dr. Piercy said last week all of the state's long-term care facilities have partnerships with pharmacies to receive the vaccines. Will KCHD have involvement in administering vaccines at long-term care facilities or nursing homes, or is it an entirely separate supply of vaccine through the pharmacies for these facilities?
So the long-term care, which includes nursing homes and assisted livings, most of them have agreed to participate in Walgreens and CVS, who are going to be vaccinating their staff and their clients. It's separate from health department operations. That they are getting their vaccine through the state, but it's separate from what we're doing. There probably are a handful that don't have that agreement yet and aren't in that pool of groups that will be vaccinated by the pharmacies. We're working to get them into that pool, but if they're unable to, we'll assist them with getting their staff and residents vaccinated. It's a very small number that we would be assisting with. We're really grateful for this partnership that Walgreens and CVS have with long-term care. Vital group to get vaccinated. So we're hopeful that that's going to happen soon. I'm not sure if they're vaccinating in Knox County yet.
From Jeff with WATE, we know you can't give us a date for broad public access to the vaccine, but what about a month? Just some idea of when to start asking the doctor or CVS.
Sorry, I can't predict that. There's so many factors that are totally out of anybody's control that impact when vaccine gets here and how much we get. And so we just have to wait and see. Maybe as we get closer, we'll be able to say that. What we will be doing is letting groups know when we move into the next phases and who's eligible in those phases.
Any further questions? Please go ahead and submit them now. All right, not seeing any other questions come in. So thank you all for your time today, and we will see you again on Thursday at 12:30. Have a good and safe week.